Namaste. This is how we greet in India. In Sanskrit, it means, I bow to the divine in you all. Good afternoon, Sydney. I'm really grateful that I have been given the privilege to stand on this platform, which has been shared by some great scientists, doctors, and especially the keynote speaker. Sydney is a wonderful place. Last year, when I first came here, I was mesmerized by its beauty. It's really blessed by nature and its archive. I come from India, which is a country rich in its heritage, culture, and knowledge. Ayurveda, which is considered as one of the oldest systems of medicine with its historical roots in the Indian subcontinent, can be traced to around 6000 BCE. But today, as soon as one speaks of India, the first thing that comes in mind is its huge population. Today, India has a population of 1.35 billion. Many consider this as a problem, but we in Parimal Banerji Medical Research Center consider this as a blessing. We are blessed to be in India, but why? For this, I need to give a little background and history of us, as this will lay the foundation stone of my speech. This history of legacy began in the year 1856. In that year, homeopathic treatment was adopted by Pandit Isha Chandra Vidyashagar, the giant benevolent reformer who changed the very structure of Indian society by his relentless services in the field of education and social reforms. The popularity of homeopathic treatment started spreading like fire when a person of his status started teaching with free homeopathic medicine. Out of many distinguished persons, even Mahatma Gandhi and Rabindranath Tagore admired Vidyashagar. Ishan Chandra, the brother of Isha Chandra Vidyashagar, continued this free treatment throughout his lifetime. Dr. Parimal Banerji, the son of Ishan Chandra, followed the philanthropic ideology of his father and uncle. He was a very learned person who established the famous homeopathic charitable dispensary at Mihijam in India in the year 1980. His method of treatment became extremely successful, and thus it created a great demand which crossed all social, economic, and geographic boundaries. His long list of patients and well-wishers includes many famous people like Saint Mother Teresa, whose handwritten letter of appreciation is stored carefully in our museum. Dr. Parimal Banerji, the son of Parishnath Banerji, joined his father's clinic in 1950. He started extensive research in this science in 1954. As he observed, there are a lot of failure in treating diseases with homeopathic medicines. He observed that there was no standardized method of selecting a drug for any particular disease, and also there was no principle for selecting a potency of a particular drug in a particular disease. His extensive research led to the theory of Dr. Parimal Banerji's Advanced Homoeopathy, which has really brought back the reliability of homeopathy. This organization has been serving about 500 to 600 patients on an average per day since the last 7 decades, coming from India and different parts of the world. This has given us the opportunity of studying the human patients who are suffering from many types of ailments. The total records of prescription served exceeds 18 million. This panorama of patients has given us the scope of studying and carrying out research and analysis exhaustively on a wide range of diseases. So today, what I will discuss has a base of 150 years and millions of clinical trials. Hence, we are blessed to be in India. Homeopathy was discovered in 1790 by Dr. Samuel Hahnemann. From then, we homeopaths are following the same rules and principles coined by him. And as years are passing by, we can see that the reliability and dependability of homeopathy is being questioned everywhere. But why such questions? Was Dr. Hahnemann wrong? Or we interpreted it in a wrong way? To understand this, let us recapitulate the history of homeopathy. Master Hahnemann was an allopathic doctor. In 1790, while translating Cullen's Metra Medica, he wanted to know the side effects of cinchona. Cinchona was used as a medicine for ague fever. So he started taking cinchona tincture 4 grams daily. To his surprise, he developed symptoms like ague fever. Being a true scientist, he repeatedly took the same drug at 4 different intervals and confirmed that every time the drug cinchona definitely produced the symptoms of ague, a disease which it can cure. As you can see in the slides, then he tried the same drug among his family members and friends and found out many new symptoms produced by the drug. Strangely enough, all participants developed different symptoms. Some developed diarrhea-like symptoms, some developed excessive flatulence, some developed bursting, throbbing headache, and some developed ague fever like Hahnemann. He noted down all such symptoms, and the interesting thing is that most of the produced symptoms of cinchona was not even known before. After that, he tried those drugs on different patients and surprisingly was able to cure them. This exhaustive procedure continued for next 6 years, and in 1796 he finally concluded similia similibus curator, means like cures like. The first volume of Metra Medica Pura was published by Dr. Hahnemann in 1811, where all the proving symptoms produced by different provers by a drug were listed under the head of given drug. To make it more easier, Dr. Clement von Boninghausen arranged all these symptoms of each drug in Metra Medica schematically by putting them under different heads like mind, head, cough, etc., etc. This was the precursor of repertory formation. For understanding the principles and rules of homeopathic medicine administration, the Bible of Homeopathy, that is Organon of Medicine, was written by Master Hahnemann in 1810. Not only that, years after years, Dr. Hahnemann changed, rejected, added, developed new ideas and concepts, and changed many aphorisms of Organon of Medicine, as many as 6 times till he died in 1843. So far, so good. Then from where did the problem arise? To understand this, let's take a deeper look. Being a doctor, we all know that each and every patient wants early recovery, assurance, and confidence that the treatment, what they are taking, will either cure the disease or can give them a relief. But most of the homeopathic doctors are not confident of their medicine selection because there are so many difficulties they are facing every day. To make it more understandable, I am describing it under few points. Number one to many approaches of both Matra Medica and repertory. In Matra Medica, under one medicine, huge number of symptoms of different diseases are noted. For example, in Herring's Matra Medica, as we think this is an authentic Matra Medica, the medicine Brainia has 47 pages full of symptoms covering almost every organ and every diseases. It has always been a great challenge for the homeopath to study and remember these huge number of symptoms. To simplify the drug selection process, repertory was created. But in repertory, under one symptom, plenty number of medicines are noted. And it is very complicated to go through all rubrics and sub-rubrics before making a prescription. Like the rubric headache in Kane's repertory, which starts from page number 132 and ends in page number 221. So 90 pages of headache. How difficult it is to select a medicine. I will now tell you a small experiment which we actually conducted to check the reliability of medicine selection. One patient with same symptom spectrum was presented to 10 different doctors and they prescribed 10 different medicines. According to homeopathy, there can be only one right medicine for an individual patient. If that is so, then the probability of prescribing the right medicine is a mere 10%. My next point is lengthy case taking. As we homeopaths need to make a totality of symptom for every case before prescribing a medicine, as you can see in the slides, all this huge information of a patient needs to be filled up by a doctor before a prescription. Making a totality of symptoms is a very long and time-consuming process. Time being such a valuable thing in today's world, this whole long procedure is exhaustive for both doctors and patients. My next point is, which is very important, that is the contradictory symptoms. When we study or consult any authentic Matra Medica, it has been noticed that many medicine contains contradictory symptoms, which are lying side by side. As you can see in Herring's Matra Medica, under that very same medicine Brainia, symptoms of diarrhea and constipations are written just one after another. Now if asked, we will say that these two symptoms were collected from different provers. Then what about the other symptoms written just side by side? As all of them are not contradictory in nature, we try to find a connection between them, though it might also be from different provers. The line of demarcation gets very hazy here. So where do we draw a line to understand it is of a different provers? My next point is lack of standardization of potency selection. About potency selection in homeopathy, different stalwarts had their different points of view. Dr. William Wood always preferred low potencies. Dr. Barnett always preferred low potencies. Dr. E.B. Nash has a very few mention of potencies in his book. Dr. Harris Ritter preferred low potency, especially in case of children. Dr. Kent, he always preferred high potencies. So whom should we follow? The answer, what medicine with which potency a doctor should follow, remains under a veil till today. Now, The obvious questions that come up after all these difficulties are, which group of symptoms to be considered and which are to be not from the huge number of symptoms given in the Metromedica? Where do I draw a line in the repertory to get prover-wise complete picture of a disease? Which medicine to be chosen from the huge list of medicines given in the repertory? Which potency is to be given for the selected medicine, as there is no specific rule? How do I reduce my time of case taking and prescription in order to give value of time in today's world? Next, treat the patient, not the disease. It's a very popular and famous principles of Dr. Kent. According to these principles, or you can say we are guided by this principle, while making the totality of symptoms of a patient, the doctor notes all the symptoms of the patient one by one, without considering the disease from which the patient is suffering from. This holistic approach leads us to search for a remedy which covers all the symptoms of the patient. The more the match, the more is probability of prescribing the right medicine. To make it easier to understand, let me share one of my personal experience. One day, one patient came to me who was suffering from gastric ulcer, and he was not getting much curative effect from allopathic mode of treatment as well as from homeopathic treatment. While going through his treatment history, I saw in his case-taking form, thorough case-taking was done, and his consulting doctor noted all the symptoms one by one, which started from his gastric ulcer, from which he was suffering since last 6 months, and also the ear pus, joint pain, one wart on her right leg, from which he was suffering since long years back, along with its modality, past history, present history, mental general, physical general, etc., desire, aversion, and ultimately he prescribed the medicine Pulsatilla. As Pulsatilla matched all these diseases, that is the gastric ulcer, wart, joint pain, ear pus, but the result was not satisfactory. Now, to understand why Pulsatilla failed, let us flash back to Hahnemann's first drug proofing. Every time Dr. Hahnemann produced symptoms like ague with cinchona, not headache, not diarrhea. Similarly, when his friend number 1 tried cinchona, he started giving symptoms of diarrhea every time, not headache. Please note here that arbitrarily, if Hahnemann ever suffered from diarrhea, headache, flatulent colic, cinchona could have never cured him, as his constitutional reaction ability had never created it. So each prover always produces a complete picture of a single disease, and we observed that a drug can produce many diseases, but always one disease in only one prover. Pulsatilla is a drug that can produce many diseases, as we know, during its drug proving. If all those diseases, that is the gastric ulcer, wart, ear pus, joint pain, were not produced in a single prover with Pulsatilla at the time of proving, then invariably it is not possible to cure a single patient from all his disease symptoms with a single medicine Pulsatilla at the same time. This basic thing was also noted by Dr. Hahnemann. He wrote that in aphorism 134 of Organon of Medicine, that all symptoms of a drug are not found in a single patient. But somehow this was missed and never followed. From the above statement, we can say what cannot be produced in a single prover cannot be cured. This is the first observation of Dr. Parimal Banerji and hence the birth of advanced homeopathy. The other important inferences which can be drawn from here are every drug manifests the same array of symptoms in a particular person and produces the complete picture of a disease. Based on the reaction ability of the given person, same drug can produce different disease in different persons. But does the above statement means every drug produces different symptoms in different person, or it has a grouping system? Let's find it out. As we know that the knowledge of disease is very essential for a doctor, hence let's brush up some points about practice of medicine. Let me illustrate by the disease flu. The disease flu has many symptoms as shown in the chart, but points to note here which are as follows. A disease has many symptoms, but that too has a limit. All symptoms do not appear together in a patient. Some symptoms are the common symptoms and the other are the striking symptoms. A combination of common and striking symptoms create the array of symptoms which produces the complete picture of the disease. Now, let me tell you a story. It is actually not a story, it is a true fact. On one fine day in Mehejam, there was a football match. The whole village was there to enjoy the match, and it suddenly started raining. But who does not enjoy rain in an open field football match? So a huge number of crowd was exposed to modific noxious agent, that is rain, or become prone to flu infection, however you term it. Dr. Banerjee's clinic being the only one in the village, next day there was a long queue of patients suffering from various flu symptoms. Some suffered from nose block with headache, some suffered from cough with chest pain and so on, but that is the extent of symptoms flu can create. So in that rainy day, say among 100 flu patients, a group like group A, patient produces symptoms, fever, that is demarcated in red line, fever, headache, body ache and sneezing. And suppose 20 patients, I call it group B, are producing the same symptoms, nose block, headache, thick discharge from nose and sneezing and so on. Let me show you our grouping chart for cough and cold like this. From these facts, we can infer that the array of symptoms of a disease can be same for two different disease can be same for two or more persons if their constitutional reaction ability to the said drug or influence is same. However, the same two person may manifest two different disease like symptoms when we change the drug or the influence is different. Enlightened by all these inferences, Dr. Banerjee started his research of mapping drug-proving symptom to disease-array symptoms. He had the mammoth task to differentiate drug-proving symptoms prover-wise so that a complete disease picture can be created. The extent of research was so deep and large that he learned other languages, especially the German, being the origin of homeopathy, in order to gain knowledge of different philosophy written in German language. This research was helped by clinical trial of huge number of patients at his clinic, and finally he was able to map the disease area symptoms to drug symptoms, which evolved Parimal Banerji grouping, in short PBG. This was clinically tried and found to give a high rate of success. He understood and proved, as you can see in the screen, when the array of disease symptoms completely matches with the array of drug-proving symptoms created on a single prover, cure is the outcome. Dr. Banerjee was still not sure about the potency, as no books revealed any guiding rules. He started doing clinical trials on his huge number of patients and recorded them minutely. Collecting these huge data, he analyzed and found an interesting pattern. This chart is given in percentage. For example, from our clinical trials, we see that the medicine Lycopodium, which can produce so many symptoms, it starts from cold, nose block to the hernia right side, etc., like this. And for cold and nose block, out of 100 patients, we try with Lycopodium 6 and the result we get 40%. And when we apply Lycopodium 30, we get result 95%. Whereas Lycopodium 200 give only 1 and Lycopodium 1000 nil. Same the thing in flatulence. If you see in this chart, you will see that Lycopodium 6, the Lycopodium 30, if you compare with Lycopodium 200, it is 60%. On the other hand, for impotency, you see that is the Lycopodium 1000 is the medicine. Every potency of a drug is a separate drug by itself. Let us again have a look at the flow chart. As you can see, each group of symptoms is now mapped with drug symptoms. That is the fever, group A, fever, headache, body ache and sneezing, group A, that is rust tox. The proving symptoms of rust tox is exactly matching with these symptoms. And the potency, from the chart we know that is it is the 30 potency. Same in case of also group B, Lycopodium 30, that is demarcated in green line with green line, nose block, headache, thick nasal discharge and sneezing. Lycopodium, the drug proving symptoms of Lycopodium is exactly matched with this, and the potency we know that it is 30. Let us again have a look at the flow chart, that has already described here. In fact, in our organization, the disease name is not flu. To our doctors, flu is just a surname, and the full name of the disease is Rastox flu or Lycopodium flu. Let us see another grouping chart of conjunctivitis. The array of symptoms are shown and the striking symptoms is denoted by plus sign. We know that redness of conjunctiva, lacrimation, irritation, these are the symptoms of conjunctivitis. And the striking symptoms here we denoted with plus sign. So in case of argentum nitricum, while we are proving the drug argentum nitricum, the conjunctivitis which has been produced by the argentum nitricum, the photophobia was excessive. From this, we know that the argentum nitricum is the medicine and the potency is 200, not 30, not 1. So a patient comes to us manifesting symptoms of argentum nitricum, we always prescribe the 200 potency. no other potency. In other words, a patient showing symptoms of Euprasia 200 conjunctivitis can never be cured by Argentum metallicum 200, because Argentum metallicum is also a good medicine for conjunctivitis, but the striking symptoms of Argentum nitricum is totally different from Argentum nitricum, Euphrasia, graphitis, belladonna. There are so many medicines. Usually we know prescribing for the conjunctivitis. So all this grouping with symptoms are written in many volumes of Dr. Banerji's, of which 3 volumes have been published till date. Our case taking is very simple and short, shown in the given chart. Attend the patient, listen to the complaints carefully, try to make a diagnosis of the disease he is suffering based on the symptoms. Because the patient produces so many symptoms in front of the doctor when we are consulting a patient, or when patient is consulting us, in that case they are producing so many symptoms. But the knowledge of disease helps us to denote whether the patient is producing any disease and what is the importance of the disease, which is to be treated first. So we categorize the symptoms accordingly. We categorize the disease accordingly. Take the help of the latest pathological test, if any, for confirmation. Suppose a patient is suffering from thyroiditis. He said, I am suffering from hypothyroidism. If documents is there, then we confirm that yes, the patient is suffering from thyroid problem, and what are the medicine she or he had taken to treat these diseases. So, arrange the disease according to the priority that I told you a few minutes back. Ascertain the array of symptoms of the given disease. Match the array of symptoms with the drug following the Parimal Banerji grouping. Potency with repetition gets selected by default because our research and clinical trial has already informed us that next, as the time is short, let me show you a live case. The case will demonstrate 2 things. The effect of selecting the correct medicine as per Parimal Banerji grouping. Same drug of different potency have different curative power. This is a case of dermatitis. The patient is suffering so long, the treatment duration is 6 months, and the medicine was prescribed arsenic album 200. You see the result. And the next slide. Here it is a case of allergic rhinitis. A boy 10 years old who is suffering since long time, and the treatment duration is 6 months. The medicine is same, that is the arsenic album, but the potency is 6. And here you see the previous report, which given to us, that was 2312, the IgE level of his blood. And after treatment, the result become 125. And next, it is a case of gastroduodenal ulcer. 44 years old male person suffering from this disease. Time we took 15 months. The medicine same, that is arsenic album, but the potency is 3. And you see the result. It was, and now it is. We have experienced success by the growth of trust among the patient endorsed by pathological report. We all know success has no boundaries. Just bring back the reliability by cure and world will trust you. Apple will always fall from the tree, whether gravitation is discovered or not. However, the great scientist Sir Isaac Newton had proved the world why it will fall from the tree. Likewise, a pinpoint prescription will always cure the patient, but we have to wait till the reason is established. Hence, I would request the doctors to bring back the reliability of homeopathy and thus the trust of the patient by following Dr. Parimal Banerji's Advanced Homeopathy, and at the same time urge the scientists of the world to find out the reason of this miraculous natural healing ability. Before I close, I would like to thank all my staff and especially my daughter, Dr. Ruma Bhattacharya and Mr. Shantanu Ghosh for preparing this beautiful presentation to explain such a huge subject in 30 to 35 minutes. I close my dialogue by requesting for good wishes from all of you for Dr. Professor Parimal Banerji for his quick recovery. Thank you and namaskar.